Let's dig into inflammation and fertility. For me, inflammation used to seem really vague. It's like, okay, what's inflamed? Like for me as a nurse practitioner, inflammation generally is talking to like acute swelling, right? So you sprain your ankle and we have inflammation around those tendons or muscles and ligaments that have been hyperextended, and we see acute swelling, we see inflammation. Or if somebody is, knock their noggin and they now have a goose egg, that is inflammation. We're seeing that the body is responding to an injury. Okay. Now, when we start thinking about inflammation when it impacts fertility, it's harder because it's like, well, I don't see it, I don't feel it, right? Like I'm not acutely inflamed. And so I think that that's where it was difficult for me as a healthcare provider, to kind of like wrap my mind around inflammation. And I'm sure that other people, it's a little like, okay, well, how do we measure this? What are we looking at? How do we know? What are signs? So let's kind of dive into inflammation and how that impacts fertility, and how a lot of times I see that patients are having huge signs of inflammation, but they don't even realize it. Okay. So when I start working with clients, I have everybody fill out an inflammation assessment, and it's really just a screening tool for me. I don't look at it and think like, this means you have this. It just means like, ooh, this system is not working as well. Whether that's your thyroid system, your endocrine system, your skin, your allergies, all of those issues, GI issues, can all be signs when you're having symptoms that are not ideal, I guess, like for having itching and swelling and fatigue and muscle aches. Like all of this can be signs of inflammation, and they can be chronic. So you don't need to have like a diagnosis or be sick, or just like inflammation does not mean that you're sick or you're ill. It just means that your body is fighting something. Okay. So what we want to work on is, we're always going to have a little inflammation. Okay. That's how your body is fixing and repairing, and it serves a purpose. But we don't want to have this chronic inflammation response. So we want to think about what are practical changes, what we can start thinking about are signs of inflammation in our own body. Okay. So inflammation, what it actually is it means that your immune system is being activated. Okay. So it is working to fix something, and you can have really acute inflammation. Again, we have an injury, or you have, a stomach bug, and you have diarrhea or vomiting. Okay, we've got some inflammation, body's going to take care of it, get rid of that virus, and then hopefully all of those organ systems go back to normal. But when we have problems with chronic inflammation, that is when it's going to negatively impact your ovulation, your egg and sperm quality, your ability for implantation, hormone signaling. All of that can be off. So fertility and your overall longevity health are going to be thriving in a more like calm and supportive environment, and not a constantly inflamed one. So some common issues that I see, or common clues that you're like, I have this, maybe I have some inflammation going on, would be really heavy or painful periods. It would be really severe PMS, and you're just like, why am I feeling insane? Or feeling so intense all of the time. Bloating, constipation, GI issues, diarrhea, GI upset, belly's hurting, fatigue, that's a huge one. If you were trying to conceive, we shouldn't be tired all the time. Why are you tired all the time? What's going on? Acne or skin issues, eczema, those kinds of things, recurrent miscarriage, PCOS, endometriosis, autoimmune disorders. All of these are common, but they're not something that you need to ignore. Okay, so we need to understand that this can be impacting your fertility. Okay, so what are we going to do about this? Okay, so anti-inflammatory diet can be a helpful way for a lot of people. You want to prioritize whole foods. We want to have protein at each meal. We want to have plenty of fiber, so we're flushing out toxins, so we're flushing out extra hormones. That's really important. We want to make sure that we're getting a good amount of omega-3s, whether that's with a supplement or through fatty fish or flaxseed or walnuts. I've got a smoothie that I love that kind of incorporates a lot of that stuff. It's in my course. Fiber from veggies, berries, legumes, beans, etc. So it's not about like cutting everything out. It's really about like making good choices and having really good nutrient dense foods with every meal and every snack. Okay. Next thing is blood sugar stability. I talked about this in the egg quality vlog. What we want is to make sure that your blood glucose is remaining stable. When we have big blood sugar swings, when we have really big spikes because we eat a carbohydrate or sugar without also ingesting some fiber or fat or protein, those blood glucoses are going to spike. And we do not want to see that, because that is going to, again, signal inflammation, signal that we are not getting a balanced diet. We're going to see things that go up and then you crash. Okay. So eating regularly, make sure that you're pairing your carbs with protein and fat and fiber. Avoid going for long periods without eating when you're trying to get pregnant. Again, I don't love the intermittent fasting for fertility. I think it serves some people, but most of the people in my space are not going to benefit from intermittent fasting. Supporting your gut. So digestion is huge. Okay. We really need a good balanced gut, because a lot of inflammation and a lot of other issues are coming from a bad gut. And there's a huge increase in colorectal cancer. We're starting to recommend colonoscopies at a younger age. Like, we are seeing that the gut is getting legit wrecked by all the processed foods and some of the habits that we have. And that leads to inflammation. So fiber, good things with prebiotics and probiotics, staying really well hydrated, implementing fermented food if you can tolerate that, addressing any sort of constipation or bloating issues. Like, why are we having that? We need to understand why. Okay. There's a lot of overlap with endo and IBS or IBD. So we need to make sure that that's being taken care of. Reducing stress on your nervous system. Like, if you're just chronically stressed, you're not sleeping well, or you're sleeping too much and you're kind of on edge, all of this is going to contribute and can be a problem. So overeating, overtraining, undereating, not sleeping well, emotional stress, highs and lows, those are not good for fertility. Okay. So we need to be working on how to be calm. Okay. Whether that's breath work, whether that's saying no to certain things and responsibilities, whether that is through acupuncture or massage or dry needling, like, where are we holding the tension? How do we manage that? Then how do we prevent that? How are we going to work through it? If we can't always remove that stress, how are we going to manage it better? Okay. Zero stress is impossible. Not going to happen. But what we don't want to do is minimize it and get as best control of what you can. And I talked about that in the course too, how to kind of go through these things. Let's see. Okay. Environment. Like, we need to be thinking about what you are ingesting, but also what are you exposed to, the air that you're breathing, the water that you're taking in. A lot of our water has forever chemicals in it, and it is one of these things that we're going to find out over time, just how negatively it is impacting things. We are already seeing that the ingestion of BPA, which is found in plastics, the amount that mom is getting while baby is in utero is now impacting what baby's health looks like. So babies are born with micropenises. Babies are born with breast bud tissue when we have too much BPA in the system. Okay. Fragrances, pesticides, cleaning products, a lot of the products that you're using on your body. I'm not saying like cut everything out. I get it. Like, we want to use our good shampoos and we want to use our better products, but just be mindful about what you're putting in and on your body and what also you're breathing in, right? So super strong chemicals and those types of things we want to be mindful of. So a lot of times, like, what I see missing is that people are like over supplementing, but they're not actually addressing the root cause of the problem. We're not going to fix everything with a supplement. I love my supplements, but I don't think that they are the cure-all for everything. And I think that a lot of times people are taking them incorrectly, and they're taking too much, or they're not taking the right thing, or they're spending money on the wrong brand, but I'm not going into that today. Another thing that I see missing is that so many people go into IVF without really understanding why they're not getting pregnant. And then they're spending all this money and time and emotional energy. I mean, it's just exhausting. And they're not calming their inflammation first. And so we don't see as good of outcomes. Okay, we're having to do more rounds. We're having failed rounds. Like, inflammation can wreck your IVF cycle. And ignoring male inflammation. Gosh, so many times when I'm working with male clients, a lot of them some of them are so eager, love that. Some of them are like, who's this lady and why is she telling me what to do and eat, etc. Like, my sperm is perfect. And it's not. A lot of times it's not. A lot of times when I'm doing my male workups, I'm like, whew, okay, I can see what our problem is here now. So, working on inflammation, it does not happen overnight. It is not something that is just going to be like you change one thing. It's all about kind of looking at the different silos of your life and seeing where we can kind of turn down the volume on the things that are making your body stressed and strained. Okay. So if you want to know what you specifically can do regarding labs and about each one of these silos for how you can reduce inflammation in your body based on your symptoms and your labs, check out the Get Pregnant Faster course. If you're interested in a more like one-on-one detailed assessment, a deep dive is a great starting place. And I also take clients one-on-one, but I can only take so many per month. So if this is of interest to you, let me know, reach out to me. I hope this was helpful, and I hope now that you can walk away at least understanding a little bit more about inflammation. Okay.